Hello, everybody. Hello, good afternoon. Good afternoon. How is everybody doing? Are you people excited to be here? Well, good afternoon to you all, to our guests, and obviously to our viewers out there. I mean, we made a lot of noise on this first episode of the Real Talk Show. The noise was there on our social media platform, and I bet even the people who are listening, people who are watching, they can attest to the fact that they have been waiting for this in as much as we have been waiting for the same. My name is Margaret Selemani, and I'm your host. I'm the one driving you today, and I am joined by a number of people here. And not forgetting, today we're discussing a very critical and yet interesting topic that each one of us can learn from. At least we can relate and we can just talk about it. Please, if you have questions, you have contributions or anything that you'd like to contribute on the show, you are free to do that. You can do that in our comment section. Our guests here, before they disappear, they'll be able to just respond to some of the questions and they'll be able to move just together in that regard. Remember, today we're discussing a very critical topic, which is how young people can prevent themselves against HIV. And obviously, this is something that we need to talk about. I mean, it's Valentine and people are excited, but then how can they prevent themselves from HIV? Before I talk much, let me just introduce my guests to you. Not forgetting that I'm not just hosting the show alone, I have my co host, who's Enoch Mtoka. Mr. Enoch, you are welcome to the show and thank you for hosting this show with me.
Thank you, and a lovely afternoon to all that is following wherever you may be, and to our lovely panel today.
Yeah, great. So let me introduce our panel for today. I will first start with Chpampe Chimba, who is an adolescent focus point person and a trainer of trainers. She has a number of titles. I didn't have where to put them, but then I'm just going to allow her to just introduce herself and tell us where she's coming from. Chwampe, you can go ahead.
Hi everyone, I'm so excited to be here. My name is Pampit Kimba. I am a psychosocial counselor by profession and an adolescent trainer. I love young people. The other titles, we'll put them aside for now. Thank you.
Thank you so much, and thank you for joining us today. I will then go to Chola Ponda. Chola Ponda is a peer educator, so I'm just going to give him an opportunity to also just introduce himself. Chola, you can go ahead.
Thank you very much, Margaret. Good afternoon, everyone. Like Margaret said, my name is Chora Ponda. I'm a peer educator. I'm also a TOT, a trainer of training for media and information literacy. Thank you for having me.
Great. Thank you so much, Chola, for joining us. And lastly, I'm going to go to Memory Zulu. Obviously, you've seen the guesses that Memory is giving us. So I'm just going to allow her to unmute herself and just introduce herself to our viewers. Memory, you can go ahead.
Hello, my name is Memory Zulu, and I'm the sign language interpreter for today. Thank you.
Thank you so much, Memory. Thank you so much. I want to appreciate each one of you for joining us today to discuss this critical and yet exciting topic that is at hand. And to our viewers, you are all welcome. And thank you so much for just tuning in. If you have a friend that you'd like to help or to just tell them to say the Real Talk Show is on, please tune in. Let's learn together and share information. So diving into our conversation for today, looking at the critical topic that we have, I was looking at I was researching something and I just discovered that according to the global and national HIV estimate, which was launched on the 18th of September 2025 at the Mulungushi International Conference Center in Lusaka, where the Ministry of Health, NAC, UNAIDS, and the Zambia Statistics Agency, where it was recorded that about 30,000 cases of HIV were recorded. About 30,000. I mean, 30,000 people were infected with HIV. So this is something that we can look at, and something that we just have to ask ourselves certain questions to say, what is it that we're doing wrong, or where is the gap? So that's why we decided to bring in Chipampe Chimba, who is a person who deals with young people, and obviously Chola, who is also a peer educator, and just for them to just explain to us some of the roles that they play in their communities, just to ensure that young people get to have the right information and they get to just do things well. So we're going to dive into our conversation by inviting Chipampe Chimba. You're going to be the first person that I'm going to talk to on this issue. So when we look at the statistics, it shows a large number of HIV infections among young people. And when you look at these young people, these are young people who are aged from 15 to 24. And then when we look at you, you are somebody who has been working with young people. So from your experience of working with adolescents, why do you think young people are still highly affected by HIV despite all the information that we have available?
Well, to start with, thank you once more for having me as a guest. Adolescents are a very special population to me. And like you said, I love working with young people. And it's sad to have such statistics, even when you have all these partners and stakeholders that are coming on board to try and help the 15 to 24-year-olds have access to SRHR services. But you know what? They say numbers don't lie. So for me, I think the biggest challenge you're having could be information gap. And so this is where now, as a healthcare practitioner, we are now following the adolescents where they are. I think from past experience, the challenge has been young people coming to, seek health care services, mostly in relation to HIV testing, or they want to test for an STI. It's like they fear to say, I'll be judged when I go to such a setup where there are other people that are involved. Of course, we have a lot of youth-friendly spaces dotted, I think, in most facilities. But another approach that has been brought on board is following the young people where they are. Meaning, we go to the markets. When you go to a market, you find young people working in the mobile like booths. They're in the salons, in the barber shops. So when you go there, you give a talk, and of course, with the self-test kit, it's something that they can test even in the comfort of their home. And then when the results are out, then now they can make a follow-up on how what needs to follow. So for me, I feel the statistics can only reduce once we feel the knowledge gap that is there. Because you can ask a young person to say, oh, we have a youth-friendly space. Have you heard about it? 1 out of 5 will say yes, they have. The rest will say, I've never even heard about that. And of course, thank you for such platforms like the youth platform, and I've featured on other platforms like the Tikambe, where you do the road shows and you do the radio programs to be able to reach the masses. But I feel we can do more. So social media is also helping. So my prayer is that we try to reach to as many young people as possible so that those numbers can be reduced. We can't be having such statistics in this time and era where information is there. Then the other thing I feel before Chola comes in is I think young people are more comfortable talking to someone their size or their age rather, because they know to say this person will not judge me. So what Ministry of Health has done is make sure that in the youth-friendly spaces, they have someone who has a heart for the young people, and they are able to relate understanding who an adolescent is. Remember, they're transitioning. This is someone who's trying to experiment. Their body is changing. So they're asking them. So they want to experiment. So for those that do not have the information, with the experiment that they want to carry out, one act of unprotected sex, I repeat, one act of unprotected sex will get this young person get the HIV. So we need to make sure that we amplify the voices and just give the right information to the young people. Thank you.
Thank you so much for that insight, Chipampe. So you've mentioned that you use different strategies in order to reach these young people, just to have the information and you get to test them. That's just there where you meet them and whatnot. Now I'm going to move to Chola because you mentioned to say the government, they have implemented an activity of having young people in these youth friendly spaces where they can actually just get information from their peers and whatnot. So now, Chola, when it comes to you, despite the information that is there in clinics and the information that Chipampi has just spoken about, what do you think could be the reason as to why most young people are still getting infected on a very high rate despite the information being available and obviously the services that are being offered at the health facility being available? What do you think could be the cause?
Okay, thank you very much, Margaret. Before I come to the cause of why young people are at least or are getting infected by HIV, I would like to add on what Chipampe has said. So the new system that the government is implementing is called fast tracking. So this is where all services like counseling, HIV testing, screening is done at the youth-friendly level. So they don't have to go inside to access all these services, but all these services will be done at a youth-friendly space with trained nurses who are also young people. And then for the increase in number of young people getting HIV, Shifampe talked about information. So young people are lacking information. We are giving information, but they have their own information also, uh, depending on where they are coming from and their background. So we have myths and myths and myths. So these what they are talking about in the community. These are things that they are believing in. For example, I would say you can tell by looking that this person has HIV. So they are able to screen someone by looking at them to say, okay, this person has HIV, and I won't have a relationship with them or get near to them. Forgetting that HIV, anyone can have HIV, no matter how they look. Yeah.
Great. Thank you so
That's it.
much, Ola, for that insight. So it's all about the needs now when we talk about young people in the community. In as much as information is there, but we choose to believe what we want to believe. We choose to believe what we're coming with when we're coming from home. Kunganda balandati, when you
Exactly.
look at a person and this person doesn't really look fit, it means this person is
Hmm.
sick of HIV. Who even does that?
Yeah.
We've got eyes that can scan a person and tell to say this person is HIV, of which I feel like that's the mistake that most of us young people are making. We are running to certain things thinking this is the safest where I can be, but then in the actual sense you find that where you're running to is where the bomb is, not really knowing. But anyways, I just want to get back to my viewers, those of you who are viewing on Facebook or on YouTube. Please, if you have any questions that you'd like to ask our guests, if you have anything that you'd like to find out, you'd like to contribute towards the show, you can just do so in the comment section and we'll be able to acknowledge that. I have a comment here that says, the other thing is ignorance. Yes, quite all right. Young people, we really need information that is just going to help us at the end of the day. So I'm going back to Chpambe. So when we when we look at the estimate, please, you should find time to just read through the estimates that was that's I was just talking about how the statistics and whatnot, what is going on among young people. So it's kind of talks about how young people are being infected with HIV and AIDS, but then it's like the gender of a girl child or young women is on the rise. Like young women and young girls are on the rise. So Chipampe, why are young women and girls more vulnerable, and what social or cultural factors that contribute to such?
Thank you for that, Margaret. So, when it comes to negotiating for safe sex, I'll say this is not just the young girls, even older women, I think are more vulnerable. You find that if you're in a relationship, if a girl is walking around with condoms, she'll be labeled that Samvela Tomfwa, na condom, and yet she's just trying to protect herself. So when it comes to the social and cultural aspect, I think we need to break these norms that have made it to say, oh, a woman cannot demand or rather negotiate for safe sex unless it comes from a man. And so, hence the statistics, you find that girls are more vulnerable and women because we also have these issues of those that are in college. They have these sugar daddies or a blazer, as they are called. And this blazer will come with an iPhone, they'll give them the money. And so, to a young person, they'll get excited. Remember, they want to fit in. In college, everyone is, wearing nice clothes. So, they want to look the part. And at the end of it, if they are not careful, they end up compromising, which makes it hard for them to be able to even say no. How do I tell a 50, 60-year-old man to say no? For me, if you want to engage in any sexual activity, use a condom. Even just their fellow age mates, you find that maybe we are talking of the age group 15 to 24. This is the age group where most of them are in secondary school and college. So remember, when they want to have sex, they won't even discuss. Sometimes the sex just happens. I've gone through in the communities to give a talk, and you ask just, a random youth and say, oh, how do you use a condom? And just how they will demonstrate the use of a condom will tell you to say we are in trouble. So for me, I feel for the women, I think they should just really have that assertiveness to be able to stand up and say, you know what, this is my health. If I'm going to be in a relationship, make things clear right from the word go to say, okay, I love you, but first and foremost, we need to test. The other big challenge that is there is most people will come to do the test after they have engaged in the sexual activity, which is not the case. So first you start with testing, to say I'm negative and my partner is negative, and of course you rule out any other STIs. Then maybe you can engage in, the sexual activity. But most cases, young people are coming to test after they've had the sex. You find that today is a Friday, so Monday my office will be packed. They'll come, no, and like you've said, Valentine's is around the corner. Everyone wants to receive a teddy bear, they want to receive a cake, they want to post on the status. But my message to the young people there, not everyone is doing it. It doesn't necessarily mean for me to feel cool, I need to engage in any sexual activity. For the ones that are doing it, be safe, play safe, so that even as you celebrate your Valentine's, remember, I always say this one act of unprotected sex will get you infected. And the other thing I think that makes it a bit hard is most people think, oh, this is a young person, she's a virgin. But remember, when it comes to the modes of HIV transmission, we have what we call mother to child. So this person would have been born with a virus and they've never been tested, they don't know. And you tell yourself, oh, it's a virgin, I'm going to sleep with her for the first time. You engage in that activity and you find to say you are positive. So the most important thing that I can put out there is test before you engage in any sexual activity so that you know what you're getting yourself into. Thank you.
Great, amazing. Chichi has just said it. One, just that same time you just try it to say, I tried to have it and protect it. That's the time you can even find yourself in such a situation. You know, we get to find ourselves in different situations in the sense that we want to suit the environment. We want to suit what our friends are doing. I mean, Valentine's is just around the corner. We just have a few days coming. And then you want to post on your status, I received this, I received it, but then in the process of just trying to post, you're going to find that you find yourself in different activities. And then when Valentine passes, it will be another issue. You remain alone and you'll be like, how I wish I never did something like this. So I'm going to Chola before I throw it to Enoch if he has any questions that he would like he would like to ask our guests. I will go to Chola and then from there, Enoch, you can come in. So Chola, Chipampe mentioned peer pressure among young people, especially when it comes to sex and just relationship. You as a peer educator from the facility where you're coming from, obviously you get to meet a number of young people that you get to interact with and just share information with. So how can young people say no or protect themselves without really feeling being isolated or maybe just judged? Because the one thing that we have here is judgment. How is this person going to think about me? Maybe if I don't do this, I'll be isolated from my friends. So now, how can young people say no or protect themselves without really feeling isolated or just being judged? Chola, you can go ahead.
Thank you very much, Margaret. So one thing that uh, affects young people is that they don't know their values. So us as young people, we have a lot of values, especially the girl child and the woman. So you're supposed to know their values, and then you're supposed to train yourself on how to say no. So there are many ways where you on how you can say no. You can delay. There's delayment. You can just say, not today, maybe tomorrow. Let's try maybe next week. I'm not ready right now. Fake your periods, fake them, so that you keep on. And then you also need to have goals. You need to set goals. It is very important. Every year you need to set goals on how you're going to run your life. So it's not about you setting goals on there. What are you going to do? What me, I'm going to school. What are you going to do to school? So many young people fall victim of peer pressure, just like Chipampe said, because their friends has an iPhone, they are living life, they are going to parties. What are your goals saying? You have set those goals. What are they saying to you? What are they telling you? So it's just about you as a young person, what kind of goals you have set. If you know your worth, if you know your values, and everything falls in place. So, what I have observed from the facilities that I have worked with, we have I work with two facilities. We have Kantoromba and Rubuto, and the most common. So the most common peer pressure with young people is substance abuse. And for a girl child and a woman, when they abuse substance, they become so vulnerable that anyone can take advantage of them. And they won't know who took advantage of them. So we have teenage pregnancies. We have teenage pregnancies without the mother knowing who the father is. Yeah, so that's the issue in our community. There is peer pressure. Young people don't know their values. They don't set goals. All they know is that I need to live my life to the fullest. But what kind of life are you living? And what kind of impact is it bringing to your life, to your entire existence? Thank you.
Thank you so much, Chola, for that insight and a great explanation as to what is really happening with young people. So, Enoch, if you have any questions, you can go ahead before I read some of the comments that we have on our Facebook page.
All right, thank you so much, Margaret. It's exciting indeed each time you have a topic around HIV. I think there's every opportunity to get that new information because the dynamics around society makes the interventions and all the information around HIV really dynamic all the time. And it's nice to see a lot of people joining us from Kitwe, from Kawe, from Eastern Province, Choma, Lusaka, and all the parts of Zambia that have been able to indicate that they're joining us on this great program. I've also seen somebody from Zimbabwe. I'm looking forward to other countries that joined us at the last edition of the Adolescent Health in Dawa are also joining us. So let's recruit more. Chipante, I have a question around there's perception around young people and society today that HIV is no longer an issue. I think that's a feedback that we're getting from some young people out there that HIV is no longer an issue. And, this is compounded by a number of other things. Society is moving to talk about climate change, the wars that are happening, and so many other things that are distracting people from getting information on HIV. What would you say to some of those perceptions from young people that HIV is no longer an issue, especially that now there's even a treatment in terms of ARVs and all the other interventions?
Thank you so much, for that question. So it's sad that we can have such sayings going around, like HIV is no longer an issue. But from the statistics that Margaret gave us in the preamble, and remember, maybe that's just a few that have accessed the services. Now, remember those that are in the community who are sexually active, they're not even using any protection or any intervention, and they don't know their status. So this can show to say we still have a lot that we need to do when it comes to HIV. So yes, we've got a lot that has come on board. We are now tackling issues to do with climate change. There are other things like cyber, but that should not overshadow the fact that HIV is still an issue among its young people. Remember, the age group we are dealing with, they are curious. I think I said this, they are going into university, they want to experiment. So most of them, their first sexual encounter, I think when it comes to preventive measures, so I mentioned something about delaying their sexual debut. Nowadays, we have young people as young as 10 years involving themselves in sex. We have young people as young as 12 years being sexually active. So for as long as this information is not given out there, then we'll keep thinking, let's move on. HIV is no longer an issue, but not until it's your cousin or your sister or your own daughter. And so my message also to the parents is like, most times they feel, at what age is the appropriate age to give, sex education to my child? But I believe when you go in the school, in the community, even the church, I think needs to come on board. I think any sexual education will help reduce these cases. So if I have a 10-year-old, I can use age appropriate information to say, oh, no bad touch, no one should touch you. Remember, for some, this HIV they get it through being raped or, defiled. So if you're not sending this message out there, someone will take advantage of a young 10-year-old and they are thinking to say, if you tell anyone, then I'll kill you. But if they're told to say, if anyone wants to touch you on your intimate area, you need to tell someone, and also building a good relationship, I think, with your daughters or brothers and sisters, it will help them to open up. So the myth of saying HIV is not an issue, right? Every day when you're testing, at least when you're doing our reports, we are able to see 3, 4 young people coming out positive, but one facility. Now let's aggregate this data, the whole Zambia, the whole South Africa. It will show to say we really have issues and we need to just still continue talking about this, the advocates, the peer educators, and we want to thank the partners that come on board, like you, the youth platform, the endeavors that you hold. These are conversations that really need to be talked about. I know we do workshops and training, but not everyone is able to listen to this because not everyone has a smartphone. But if we have peer educators, in the facilities, in the schools. So me, I think even in the schools, we need to train young people on just this basic HIV information so that they can share amongst themselves. This way, then we can tackle the issue. But if we just leave it to say no, unless someone goes to a clinic, what if they don't have access to a clinic? Then it will just, so we need to just continue sending a message out there and just try and, raise the awareness. Thank you.
Awesome. So, in terms of just in simple terms, I know in the first place you said that there's information that we need to push out there because a lot of young people still lack this information. I agree with you because in the past, whenever there's a gathering for young people, or whenever there's an intervention by health personnel or indeed any other program health related, I think the opening session would be around the HIV prevention and stuff like that. So in the recent past, I think that is not happening. And it goes to show how much gap that is there now. So in simple terms and using simple language, what ways do you think young people can effectively use to prevent HIV infection?
Um, First and foremost, let's delay sexual debut. I know the abstinence thing is no longer there. It's like, I want to experiment. You said earlier to say, oh, there's ARV, so I'll just go ahead and have the sex. But I always say this: there's nothing wrong. You are worth the wait. And to the girls that are already sexually active, you can still, reach out and find ways that you can prevent yourself from not getting HIV positive. So delaying sexual debut and ensuring that you use protection correctly and consistently. These condoms are there and they are available in the youth-friendly spaces. Like Chola Ponda said, we have peer educators who will demonstrate to you on how to use a condom correctly and consistently. So visit a youth-friendly space near you and just access this service. And then, of course, we now have PEP and PrEP. So for PEP, these are for those that you are raped, or maybe you just, we have these house parties that are happening. So with this same Valentine's around the corner, a lot of young people will, try to experiment. The boy will say, if you love me, you have sex with me. Tell him, if you love me, you won't have sex with me. But, that's a story for another day. But so make sure that stand your ground. Let your no be no. And if you should engage in any sexual activity, at least use a condom correctly and consistently. Then for those that need to access services like PrEP and PEP, these services are available for young people. Visit a nearest facility near you and explain to them to say, oh, I've heard about PEP and PrEP. Can you explain to me what this is all about? And that way the young people will be able to, get the preventive measures. So the first step is delaying sexual debut. Abstain, use a condom correctly and consistently, and access PEP and PrEP services. These will be able to save a life. I will say this again: one act of unprotected sex will get you HIV. Thank you.
All right, thank you so much. Margaret, over to you. I know that there's a dozen of messages that have come through, so we'll do well by engaging with those that have sent in their messages. Yeah, so quite a number of messages that have come through. Let me just acknowledge some of those messages. I'll try and read. There's Doris J. Mwene who says that thank you for making my birthday special, but TYP. Thank you. Happy birthday to you.
Happy
And
birthday,
we celebrate
Doris.
your
That was
birthday.
a promise. We promised to Doris that we are going to she should join in and wish her a happy birthday. And thank you so much for joining,
Okay.
Doris.
Okay.
Okay, can I go ahead, Enoch?
Yes, please. I didn't know that you had rehearsed with Doris, so that it's this particular show coincides with her birthday, but all the same, her birthday, Doris.
It
Yes,
was a
please go
deal. It
ahead.
was a deal.
Okay.
Sure. So I have a comment from John, and John is saying HIV remain a threat to young people, but but let's continue doing the teaching in the communities, schools, and health facilities. Let them understand the consequences of unprotected sex, and let them know the importance of HIV prevention. Thank you so much, John, for coming through and for your comment. And this is also Micho. Micho is saying, I feel you young people overrate the youth-friendly spaces in meetings and reports. I can still challenge anyone that the facilities only have youth-friendly services on paper and not in reality. Quite all right. Chipampe mentioned to say we have a number of young people who don't even know that youth-friendly spaces exist. These spaces exist, and I feel now this is where now Chola needs to come in and just ensure that a number of people get to know about these youth-friendly spaces that we have in health facilities. So I also have another comment from Andrew. So Andrew is saying, as much as we are talking and educating young people on HIV prevention programs and other measures, let's also educate the young people to be aware of other sides. Most of young people are now excited because of PrEP and PEP, but there is also a trend in syphilis. Thank you so much for coming through, John. I also have another one from Moffat. Moffat is saying, I think the match focus is mainly on the female folks, but most of the stakeholders, when it comes to the fight against HIV and STIs, is forgetting the male gender. So I feel I feel like we need to balance. It's not that the numbers for young boys are not higher, but instead they just don't go for testing. That's very true. So I have a question here of which I would like one of our guests to just um, respond to it. This one is coming from Kelvin, and Kelvin says, what implementation plans have you put in place to secure the youths in rural areas and get informed about HIV? Chipampe, you mentioned that you get to have these community visits where you get to meet a number of young people from different communities. So, what is it? Kelvin is asking to say, what implementations have you put in place to secure youth in rural areas and just to have them informed about HIV and that? Chipampe, you can go ahead.
Thank you for that question, Kelvin. So when it comes, I think someone said the youth-friendly spaces are just on paper. I think when it comes to such services, ownership should come from the young people. I know when we talk of a youth-friendly space, we want, a room with nice posters and computers and all that. But remember, we are getting there. We are a third world country, and getting all these resources cannot be, easily sourced. And so if young people themselves in the rural setup say, okay, I think every Friday when we're having a football game or something, we'll sit around a tree and just talk about the issues that we are facing. That is something that will make stakeholders to come on board and say, every Friday we've noticed there's a group of young people that meet and, they're in the sun and there's that, they once they take up that ownership, it will be easy for government and other people to really try and make sure that these youth-friendly spaces are in every corner. So for young people that want to get more information, especially in the rural areas, you can start up the youth-friendly space. Not much is needed. All you need is the right information. So like Ponda said, there are trained peer educators that are trained, I think, from almost all the districts. So once you attend these trainings, it's not to go and pack that certificate. You get the information, go and spread it out there. Even if you're alone, most of the time, the young people ask, what is in need for me? But if you have a passion to make a difference in your community, even if you're not getting much, You go out there and say, you know what, I've noticed there's a lot of teen pregnancy in my area, so I think I can have a meeting with the WDC or the chairman if it's in the village setup, and just call for a meeting. If it's in the church, you can ask even for just 10 minutes. Make it count and spread the message. If it's in the schools, you can ask for 10 minutes when you're having your assembly. Talk about HIV. And young people are able to listen when it's someone their age, unlike an elderly person. So the only way this can work is young people taking ownership and not really, blaming to say, no, there's this that is not for us. What are you doing yourself as a young person to make a difference in your community? Otherwise, that is all I can say. Maybe Ponda would like to elaborate more on that. Thank you.
Thank you so much, Chipampe, for that explanation. So I have another question for Chola. You can think in the, maybe we've forgotten about you. We can still see you. We can see you, Chola. So I have a question for you, and this question is coming from Boniface. So Boniface is saying, so what do you think could be a very effective solution to these issues, Chola? Oh, Chola's just dropped. Okay, Chipambe, you can go ahead and just respond to that question. What 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 do you think could be a very effective solution to these issues that we're talking about today?
So the effective solution could be like the name of the show, real talk. Let's have these conversations. Sometimes I feel, the conversations that are supposed to be had are not being held. People want to pretend like, no, sex is not happening. No, my child goes to church, so they can't be involved in this. But you're not with your child most of the time. So once the conversations are had and openly and truthfully, then we'll be able to understand to say, oh, okay, these things are real, and we can find a way. So the most important thing is to be open and have as many conversations around such issues. Even in the groups, I think young people have these things they form, to my gangs, not bad gangs, but they have those to my groupings. When I knock off in the evenings, I find a lot of young people in the road seated. Sometimes I'll just try and have a conversation with them, and you'll be shocked the information they'll give you. So for me, I feel even to the men, I saw a message earlier that complained, or rather, not really complaining, for lack of a better word, that said most of the stakeholders are focusing on the girl child, forgetting the boy child. But I think the men can take up this and say, you know what? I think on Saturday when I knock off from work, or if I'm not working, I'll buy a soccer ball and I'll go to my community. Ngana sanga wale tea bola, but those that are, they and I give a talk. It will start from there. But if we want to put the blame on saying, no, we are focusing on the female child and forgetting the boys, yes, this is very true, but also the men should just take up the ownership and say, you know what? I think in the month of February, these 2 Saturdays, I'll dedicate them, to just have a talk with a boy child, a real talk. Who is a boy? Where are you seeing yourself in the next 5 years? What do you want to do with your life? And that way we'll be able handle these issues. So, in the preventive measures, let's just have the honest conversations and things will reduce. And to the stakeholders, let's not just focus on the girl child. The boys are complaining out there. Let's bring them on board. Thank you.
Exactly. Thank you so much, Chipampe, for that contribution, or rather answer to the question that we have. So we have another comment here from Andrew, and Andrew is saying, following from Chipata, Eastern Province, and he says, working with a condom can't simply mean a person uses a condom. When we have heard such issues where you have a condom and you end up not using it, I feel there is also need of teaching on behavior change. That's very true. And he continues to say it's the same as people not using a mosquito net when they really have. So Andrew's just basically talking about working working with the working with the condom, but then you don't use it at the end of the day, and just the aspects that there when people find, like for example, when a girl is found with a condom, people will start assuming to say, oh, maybe this person, she sleeps around and whatnot. But then in the actual sense, they're forgetting that the only thing that this person is trying to do is just prevent themselves at the end of the day. So I have another comment from Brandina Banda. I think, Chipampe, you mentioned something similar to this. where you mentioned to say it's Valentine's Day and obviously a number of girls. I feel so much happy when I'm talking about this because I know that it happens and I've seen it happen around my circle where a number of girls are so excited about the day itself and others are not excited and they are under pressure because they feel like they need to be on the same page with the other girls. And then Brandina here says the other thing is transactional sex, where economic pressure leads to risky behavior, especially when it comes to us youths. And this is something that is happening, and it's really true. We have so much peer pressure amongst us as girls or us as young people, and then we just end up doing certain things that lead us to something really dangerous and something harmful to our health. So Chipampe, I have a question for you. You mentioned to say, I'm so much interested in the fact that you mentioned to say you don't just sit in those health facilities like the clinics where you're stationed, you just sit there as an adolescent focal point person and young people are just coming in. But you also have an initiative of just going out there in the community, just meeting those young people who are unable to come to the health facility. Obviously, there's something that we're scared of as young people that we might not even know of. But then, so at the health facilities, there are services like HIV testing, there is PrEP and youth-friendly services. So now, what should young people know before accessing these services? And how can clinics or health facilities make sure that these young people feel safe when they visit the facility? Chipampe, you can go ahead.
First and foremost, these services are for free. They are absolutely free. There is no charge attached to them. Then, secondly, I think I mentioned earlier, we've put young people that, when a young person walks in, they won't be scared. Because you have situations where if a young person walks in and they find an elderly person, they've come with an STI, but why? Because they feel, if it's family planning, you find a 15-year-old will say, they are the friend to my mom. So the first thing is first, the services are for free. And if you want to access them, just visit a youth-friendly space near you, or if not, at least next to your community, because there are certain people maybe they won't feel comfortable. Let's say I stay in Kawama and I'm scared, I can go to Chifuwu or Pamozi and access the service. Then secondly, I mentioned something that we call taking the service where the young people are. So what we are doing when schools open, we have what we call school health services. So we'll talk, let's say in this week, we'll visit this school and we are going to talk about teen pregnancy. So those are the issues that are talked about. And of course, when it comes to drug and alcohol abuse, we also have, DEC come on board and we have these talks. So basically what we're just trying to do is try to reach out to as many young people as we can. Also hosting road shows or going to the markets and just talk to the marketeers. And remember I said young people are found in the marketplaces. They are working in a mobile money thing. They are owning a barber shop, a salon. Some maybe they're even drinking. Of course, it's not easy talking to youths that are, at a bar. But for some who are, really want to know about their status, information is given, and then we tell them to say, come to the clinic when you are, in a sober state of mind, so that the right information is grasped and you are able to prevent the HIV. So that is how it's being done. Thank you. I see Chola come back, so maybe you can also elaborate on that, like what young people need to know when it comes to accessing these youth-friendly services. Thank you.
All right, thank you so much. And Chola, welcome back. We
Thank
thought
you.
you went for good and
Network
it's good that
issues.
you're back.
Thank
So
you.
I would also like you to as we are winding up, I would also like you to just give us an insight on how you do it as peer educators at the youth friendly space, in the sense that young people they get to have that feel of being judged or maybe just not feeling free to visit the health facility. So as a peer educator, what is it that you do to ensure that young people are able to approach the youth friendly space and obviously the health facility to access these services that we're talking about?
Okay. So as young people, um, mostly we talk to young people who are coming in the facility who don't know where they are going, but they are there to access a service. To access a service. Um, Not everyone knows about the fast tracking strategy, and not everyone knows what goes on at the youth friendly space. So we are there to give guidance. We are there to show them on how condoms are used, what other ways young people can, you know, implement whilst they are in a relationship. We are also there to um, help them with counseling. So we do one-on-one counseling. We do group counseling. So for Rubuto, we meet every Saturday, and for Kantaromba, we meet every Friday. Yeah, so we invite young people from different communities. We come together, we sit down, we talk about issues that we are facing in the community, practical issues that we are facing. We don't talk about things that um, written from the book, like the school curriculum. No, so we talk about new issues, and we from the trainings that we have done, from the things that we know, and from the things that we have learned, we are able to help them, give them guidance, and share knowledge according to where we're coming from. We have different activities. We have games, we have exchange visits, we have exchange parties with different facilities. We also do outreaches where we go into communities to preach about abstinence, to preach about HIV and AIDS counseling and testing. We also distribute condoms. With uh, help from different stakeholders, we are able to reach at least different areas according to the resources that are there. So if you have transport, we go in deep into rural areas like the question that I left, what strategies are we using to reach people in rural areas? So we go there, we distribute self tests, we show them how to use them, we distribute condoms, we preach about STIs, we also tell them how they can come up with their own youth friendly space. Not forgetting the CDF aspect. We have young people who don't know where to access CDF, and it because they're not doing anything. They engage in sex as an activity, as something to kill boredom with. Yeah, so we also do give them information on CDF so that they can access at least a skill. They can have a skill and they can better their life. Yeah,
Right.
so as peer educators, that's what we are doing.
Hmm. Amazing. Thank you so much for that answer, Ponda. So we've run out of time and we really need to go. I know these conversations, they really need a specific time that you need to just talk about them, answer the questions, and just contribute even to our online community. We want to say thank you to you for just being active. Like there's so many comments in the comment section, and if you still have questions that you'd like us to respond to, Chipampe and Chola, they're both on WhatsApp, they're both on Facebook. They'll be able to help us with some of the responses in the comment section. So before we go, I would like Chipampe and Chola to just tell us your last words. Like, what are your last words to young people when it comes to preventing themselves against HIV? I'm giving you 1 minute each. So I'm going to go with ladies first. Chipampe, you can go ahead.
Thank you so much, Margaret. The message is clear to the girls. Love yourself first. don't also external love. I think what puts us under pressure as ladies and women is because we want Chola to tell us, I love you. If Chola doesn't tell me I love you, I feel I'm not of a human. So please, girls, love yourself. Then, secondly, get to know your HIV status. If you are sexually active, visit the nearest clinic for HIV. And when you know your results, stand your ground when it comes to giving protection or if it's accessing PrEP or kids. But if you can't, please delay your sexual debut. Otherwise, it's been great having you and having these conversations. As Valentine's is around the corner, please be safe, play safe. I love you. Thank you.
Thank you so much, Pampe. Chola, you can go ahead with your last words.
To my fellow young people, to the ladies, to the women, you have the power to say no. It's your body. It's no one's body. No one has an entitlement to your body. Even in marriage, you have rights to say no. Practice safe sex. Use a condom in and out. PrEP is there for you. Everything that you need to protect yourself is there for you, free of charge. So if you get sick, it's on you because everything is on you. In fact, everything is on you. You have all the rights that no one can take that away from you. Thank you.
Thank you so much, Chola, and thank you so much for being on this show. I will throw it to my co-host. My co-host, you have anything to say before we close?
Yeah, really just to thank the panelists and our lovely audience. I know that we couldn't read all the messages. Trust me, this particular show will still be available on Facebook and all our platforms on social media. We'll still make an effort to go back there and engage. So keep those messages coming. Yeah, we'll definitely make time to read them. My takeaway message from here is that HIV hasn't gone away and no other emergency in the world has replaced HIV. So you owe it up to yourself to protect yourself by taking precautions and adhering to the messages that our wonderful panelists have been able to give. So thank you. I enjoyed the show.
Thank you so much. And I just want to say thank you to our guest once more. Thank you for bringing such insights and just amazing information that we can learn from as young people. And a special thank you, of course, goes to Memory for being available to just help us with sign language. And TYP is inclusive and everybody is included. So thank you so much. And to our special viewers out there, like you've been fired today, and I am so excited that we've been able to participate. And please, if you still have questions, if you still have contributions or anything, the comment section is still open. You can just join us and we'll be able to respond to you. We'll be able to interact just within the comment section. And don't forget to tune in. We'll be right back with another amazing and yet interesting topic. Thank you so much for joining us today. Bye bye.